Anshu, I'd like to turn it over to you in terms of, how, if you can share your vision of how a multilateral organization such as WHO and other global decision makers can work alongside governments, NGOs, development agencies. You heard from, the development finance institutions, also UBS Foundation, in really, training, hiring, and compensating, and, really turning these women not only into the frontline health workers, but women entrepreneurs that we need them to eventually become sustainable over time. So I'm sorry for that full loaded question while you're driving, but we do seek your expertise to really translate some of our G7 deliverables into action.
Thank you very much, Joanne. And I think it's very important to also highlight that not only is it important that educating the female health workforce at international standards in order to be able to deliver quality care, it's also very important to understand that for many women in the community, access to female health workers for their own care and for the care of their children is let's say, essential. And so this is, I think, two sides of the same coin, let's say, that it's not only empowering women to be properly trained and to be potential entrepreneurs, have their own clinic, provide services to the community, but it's also very important for the community to be able to have access to services that we train female healthcare workers. So that's, I think, an additional point, because many points have been made earlier, I think. Secondly, I think what's very important is the issue about quality of care and the value of the investment. We can do trainings, we can keep on training people, but often it doesn't have an impact. And the reason why is because either the system doesn't provide the right kind of supervision, either because the supply chain is not there in order to deliver the services, either the feedback loop is not in place. And so it's very important that female healthcare workers are trained up to international standards so that we know that the services that they will deliver will be of quality and therefore will have impact. So that's, I think, an additional point, and that's where WHO can come in. We, as a UN health organization, together with partners like UNFPA, UNICEF, we provide training for healthcare workers. We support ministries of health to set up training institutions. But I think another important point to highlight is the private sector. We know that in a number of countries, and particularly Pakistan would be one of them, that 60, 70, sometimes more than 70% of the actual healthcare is provided by the private sector. And that's why, again, this entrepreneurship for women is so important. We also know that a number of the training institutions are from the private sector, and therefore also investing in training institutions, both in public and in private ones, to ensure that they are accredited and that they deliver quality training is very important. So these are, I think, a couple of additional points that I wanted to make. We, as a UN organization, work very closely with the government, but we have a private sector engagement strategy that ensures that we build the capacity within the government to engage with the private sector so that the private sector can contribute to government goals, which are, of course, aligned to the Sustainable Development Goals.